there are two presenters, so I'm going to go pretty quickly. I have more slides. I'm happy to share some of these afterwards, but I don't want to take up too much time. So without further ado, we're just going to jump right in. Again, I always like to sort of lay the foundation on what we mean when we use the term mental health, because it has a lot of different meanings and cultural interpretations. So when we're talking about mental health, we think of it holistically. The World Health Organization talks about health generally as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So it's kind of a lofty standard. I don't think anybody can say they're fully healthy with that sort of high bar being set of complete mental, physical, and social well-being. And I think we're kind of on a sort of a spectrum of well-being, and that changes daily and even throughout the day, both our mental health and other aspects of our health. So I think it's important to just acknowledge sort of where we're all at. When the World Health Organization talks about mental health, they talk about a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stresses of life, and can work productively and is able to make contributions to his or her own community. Again, that fluctuates daily for many people, and some may struggle more than others, and there are obviously resources to help with that. And what I'm going to talk about here is just one of those resources. So again, when we're thinking about the definition of mental health, we're talking about sort of this broad spectrum of well-being, mentally, socially, emotionally. So I just wanted to lay that foundation, because the intervention that we're going to talk about here, Problem Management Plus, is really a psychosocial support model. There are other models and services, like you'll hear about from Medina and John V, where people who need that additional support can find that. But there are some ways that we can provide support just with it, building a network of support in the community and training individuals, lay individuals, to be able to provide the support that people need who are brand new to our community. So the aim of what I'm going to start where we are now, and then I'm going to back up and tell you how we got there. So where are we now? Right now, we're trying to cascade or scale up this Problem Management Plus model, and I'm going to tell you about what that is in just a few slides, to support refugee mental health across the state, and to sustain that model through integration into refugee resettlement service provision. So that's sort of, we're working with the Bureau of Refugee Services right now, the Center for Human Rights and the College of Law and the College of Public Health, to be able to scale up what we had, what we learned. So that it's an exciting sort of phase that we're in right now. The objectives of the scale up are to first to identify the landscape of engagement of resettlement agencies and ethnic community-based organizations, or ECBOs, related to refugee mental health. So we kind of want to know what is currently happening, and we're in the process of doing that and interviewing different individuals from agencies across the state. After doing that, we are going to adapt the training modules of the Problem Management Plus program, and then go ahead and train what we call community facilitators and supervisors in this model. And again, I'll talk about that in a few slides, but essentially we're looking to do this in sort of 4 counties or regions or areas: Johnson and Lynn County, Polk County, Potawatomi, mainly Council Bluffs, and Woodbury, Plymouth, mainly Sioux City. So more or less where we have resettlement agencies already stationed. After doing those trainings, obviously implementing the intervention and evaluating how it works, and then looking how to sustain this. So it's a really an exciting time, I think, for the state, and the state is investing resources into seeing this happen. And I think hopefully in the next few slides here, you'll understand a little bit about why I'm excited about this. So I'll tell you, those who aren't familiar with Problem Management Plus, I just want to go over it very quickly about what the intervention entails. So essentially, like I had mentioned earlier, it's a psychosocial support model. It's actually just 5 sessions, so it's not really long or intense, but it's 5 sessions of psychological intervention. It was developed by the World Health Organization in 2013. And it's designed for adult populations specifically affected by humanitarian crises. However, we're starting to see it implemented here in the US. We were the first state to implement this in the US among refugee communities. New York is now starting to do this as well, although they have quite a different model in that they're training up students to be the lay support for individuals, refugees, and immigrants in the New York area, whereas we are training up community members to be that peer-to-peer support. It can be delivered by people without mental health professional training. That's one of the, I think, the advantages. These are people who care about their community or invested in their community, but don't necessarily have a background in mental health support. However, they are supervised and mentored by people who do. So that's an important aspect too. It uses components of stress management, problem-solving therapy, behavioral activation, and strengthening your social support networks in order to sort of get through those 5 sessions. There is a group format. We have not used that. We were intending to use it in our pilot study, but we have not, unfortunately, because of COVID, and I'll get to that in a minute here. And it typically takes, so there's 5 sessions. Each session is about 90 minutes long, and you usually meet about once per week. If you're in a group session, it would be about 2 hours just to accommodate for the group activities. So what do these 5 sessions look like? Essentially, you have kind of the introduction to PM Plus so that people understand what it means. We do a sort of a basic sort of understanding of where people are at. So there are a number of different self-assessment tools that we use throughout. I'm not going to go into detail about those, but we have a number of self-assessment tools to find. First, is the person really in a place where the PM Plus intervention is going to be useful for them? Or do they need additional support? And we would make a referral in that case. Or where are they starting? So what are some of the main issues that they're dealing with? And then helping them understand adversity and just building one of the very first activities, which is slow breathing. And it can really be an aha moment when people understand how to do that deep, slow breathing to help mitigate stress in their lives. So again, it's equipping individuals with a set of tools that they can sort of go to in order to help them through different problems that they may be facing. So the next session, you actually start listing and choosing a problem. So you list out what are the problems, what can you identify right now that you can work on. You define and brainstorm solutions for that problem. You kind of choose a solution and you develop an action plan. So it's a really important session where that, again, these are all being facilitated by a peer, so that hopefully, in that case, it's linguistically and culturally appropriate, and you're going through those scenarios with that trusted peer. The third session then, is sort of this breaking the inactivity cycle. So if you're feeling down, and depressed, and maybe you just don't feel like getting going. You've now identified the problem. It's a single problem, you can work on it, but you just don't feel like doing it. How do you break that cycle? How do you build things into your life to kind of keep going, get going and keep going, as we say? And I identify different activities to take care of yourself and make sure. And so again, equipping those individuals with the efficacy to be able to do that on their own. The fourth session then is about identifying your support network. Who is in your support network? How can you grow and build that and rely on that to face problems as they come along? And sort of role, and all of these sessions have role plays, but role playing how you would ask for help in that task. And then finally, building those skills and consolidating those skills to help others in your cycle, and then be able to turn back to these 5 sessions. Although it's over at the end of 5 sessions, we usually walk alongside the individual as long as they need, and can be there to help connect them. But the idea is that as problems arise, they have a new skill set that they can use to address that. So let me just. So what we did is we piloted this. We trained 8 community facilitators. So these are the people implementing the PM Plus model, and 3 supervisors, 1 in each county. And we did this training from January to March. So Joan, I think that's probably when you were connected with us. And I still remember in January, one of the Lynn County Public Health individuals who was really involved with this, Heather Metter, at the beginning of our project, taking a call about some weird infectious disease in Seattle that we should be paying attention to, and thinking, it's probably no big deal, let's continue on. And then in March, everything went online. And unfortunately, that was right when we were getting ready to start. So we switched quickly to remote therapy instead of in-person group therapy, which didn't go so well, as you can imagine. Building trust is something that is better done in person than on a phone, but we tried our best. We were able to start to move into in-person one-on-one therapy with safety protocols in place in July, and then we ended up, we had to finish everything up in September because of the grant was ending at that point, and we were able to test this with 6 clients total. At the end of the project, we did an evaluation and we conducted some interviews with supervisors, community facilitators, and clients, asking them about the training, the implementation, and the overall impressions of the program. And then we recorded those. We had, went through and did a formal coding process to come up with some of the main learnings from our pilot intervention. I am cognizant of time, so I have slides that I can go through that sort of go through those pilot results, but it'll probably take 5 to 10 minutes to go through them. I'm happy just to share them also with the group if you'd like to look at them. I'm not sure what you'd prefer, because I want to leave time for Dina and John B as well.
Well, we will have this posted, if that's okay with you, on our websites and we're recorded. So how about, I think probably if we could have that for people to refer back to would be best, if that's okay with you.
With the slides?
Yeah.
Yeah, okay, yep, I'll certainly share those. So we did it, we found that essentially that it worked pretty well, but there's some adaptations that we needed to make, and that's what we're going through right now, is learning how to better recruit people who to fill that community facilitator role, and supervisors to support them, how to to better implement this to make sure that people are feeling healthy at the end of the 5 sessions, or provide the support that they need, creating better referral networks. But ultimately, people were very happy, and we saw a lot of change, not only in the clients, but in the community facilitators themselves. Felt very empowered, and we're starting to use the skills that they build to just in their normal everyday relationships, which was fantastic. That's sort of the whole idea. So I'm going to skip through the slides, but again, I can more than happy to share these. So we're at the point right now where we're working with resettlement agencies, and sort of thinking through what their role is going to be. So moving forward, these resettlement rockers, I think as some of them are called, but I think are coming up with some ideas of how they will support this. So there'll be a sort of a monthly meeting between University of Iowa and these different resettlement agencies working on the rollout of this program. There'll be an individual sort of base at each resettlement agency to help coordinate their efforts. They'll participate, obviously, in sort of informing us what activities they're currently doing, then going through the training, suggesting potential supervisors and facilitators for their areas, and then promoting this throughout the community as we roll it out in their area. We'll also be collecting some data, which is part of the program. It's not actually part of the research. It's just part of the program of tracking how people are doing, making sure that they're improving and that things are going well. So we're kind of at that phase right now. We just received word last week that the Bureau of Refugee Services had accepted our budget. So we'll be hiring a program coordinator for this whole effort to scale across the state. And we will hopefully be rolling out a training, probably starting here in Johnson and Lynn County in the next month or 2. So you can kind of look forward to that. I'm happy to take any questions.
Well, Will, thank you so much. And I'm sorry that that we didn't allow you the time that you probably deserve to do all of this, but I'm so excited about having the peer component to this, because there are so many cultural issues. So if we know of someone who would be a good peer support person or facilitator, or if we, what would be the best process to help you outreach on that piece of it? Or maybe you don't need any right now. So.
Yeah, no, I think we'll start the recruitment process, and I'm not exactly sure how many community facilitators we will end up hiring, but I'm guessing it'll be in the range of 3 to 4 for each county. I have to go back and look at what we had said. But yeah, I'm not, and we're still sort of working out the vetting process. I'd say at this point, because certainly there are people like, oh, I know somebody who'd be perfect for this, which that's kind of what we want to do, is just word of mouth for people who are interested, committed, have the time, which is really important, because it does take some time. And community facilitators will be paid through this project. So that's another thing. We're not just asking people to volunteer their time. They'll be
Yeah.
paid for their time going through the training and through meeting with clients, etc. So I'd say at this point, you can send the names to myself or to Rima, and we will pass them on once we get that project coordinator hired. We'll pass them on to that individual. But I'd be happy to take those. I'll throw my email in the chat here.
Great. Other questions for Will? What, and I guess I have one more. So kind of a timeline, you're recruiting a program coordinator now, and then you'll be training. And so what's your timeline for when you would actually be able to be recruiting for participants?
Yeah, I'd say if we do the training the next month or two, it'd probably be the month after. So I'm guessing in the next 3 months. So
Okay.
that would be putting us probably to the start of 2023. We'd be and we'll certainly reach out to this group as we start to do that, and probably as we put out a formal request for people to be hired as facilitators and supervisors. You know, we'll definitely want to leverage this network, which is a fantastic network.
Okay. Yeah, and I think that fits really well with what we're trying to accomplish too. So I think that would be a great partnership for us to work on. So.
And I'll pass around the coordinator position to this group as well, since it'll be that'll be a full-time temporary position this year with the option of renewing for a second year.
Great. That's fantastic. All right.
I'm curious about language because I find that we work with the African population, and I find among the people who mostly need mental health help, they're also not, the English is limited. And in Johnson County, I'm thinking of Swahili, Arabic, and French. I'm curious what's going on there.
Yeah, because this is a peer-to-peer model that ensures that the individuals who are trained as community facilitators speak the languages of their community. So in our pilot test, we had people from the Congolese community who spoke either French and Lingala or Swahili. We did have people who spoke Arabic. We had individuals from the Burmese community. And so we are looking for a diverse range that reflects the population, and those will be the individuals that will be hired. So it is a requirement that the individuals speak the language of the population who's looking for support. So those would be the primary languages.
Great. Good question. Other questions? Okay, well, I know, Will, you have to motor on to something else, so you probably can hang on for a little bit longer, but maybe we'll just go ahead and move on to Adina and Anvi from the Iowa Refugee Counseling Program. And I know that this has been a service that was at Iowa City Compassion, and when I was still at the school district, I referred a couple of to that, which was a fabulous service that didn't require insurance and all of that other, barriers that often are a problem for some of our immigrants. So I'm excited to hear more and we're back in person for that service as well. So I'll let Dina, I'll let you take over from here and let us know about this resource.
Are you able to see my slides?
I saw them briefly now. No, it's a,
Yeah, I thought I saw them briefly too. Sorry. John B actually has to leave early, so she was gonna be the sharing person, but
oh, sorry.
sorry, I just need a second to make sure I got this. Oh, let's see, there it is. All right.
Oh,
Are you able
great.
to see that?
Yes, we got it. Perfect.
Okay. Let's see. Oh, there it is. Okay, I was looking for my toggle thing. Okay. Yeah, so John B and I are both going to be presenting today. And just move you guys over a little. Our title is Mental Health and Wellbeing Among Refugees. And we're just going to start by just saying who we are. We are within IC Compassion. Teresa is on this call. She's the executive director, but we're using, our offices are within IC Compassion, and Noemi Ford is our program director. She is a licensed clinical psychologist. Gabe Badzin is also, he's assistant program director, and he's my supervisor, and John B supervisor is Noemi. And I am a master's in social work graduate student in my second year. I'm one of the counselors. And John B is in the counseling psychology PhD program. She's one of the counselors as well. So we're basically offering weekly sessions for children 12 and up and adults. And we're offering groups and workshops as well.
I'm going to go over and talk about why it is important to talk about mental health among refugees. The first thing is it often gets left out. If you see the Maslow's hierarchy of need, when there are so many things to worry about, including food and survival, that mental health often gets left out. But it still has, people still have a consequence on their mental as well as physical health. So if you don't talk about mental health, doesn't mean it just stops existing. And then there are challenges that refugees have to face on so many levels, including unique individual experiences like family, relationship, could be like domestic violence, grief, a lot of those things. There could be other issues like experiences of the country that they were living in or they were born in, like threat to their own community, cumulative trauma, unfinished business. Maybe a lot of people can't go back home. These things can be really challenging. And also on the receiving countries level, where the attitude could be an issue, how people are treating them, language barrier, finance, racism, even navigating cultural differences can be pretty challenging. And that's why it's extremely important to talk about mental health. Okay. At the same time, there are a lot of cultural or interpersonal barriers to therapy. I think the first of them is many people are unaware of what therapy is. In a lot of countries, the luxury of therapy is not easily available. So it's not as easy as just referring someone and telling someone, oh, you should go to therapy. It's not as easy because a lot of people are not aware of who is eligible for it and what happens in therapy. And a lot of times people might think like, how will it help to even talk about my problems? A lot of times it's like, it's just going to make it worse. But as you can see the image here, that's, I think, a very beautiful depiction of what therapy is, because when you're thinking about your own thoughts in your own head, it can get very complicated, and you may be getting into a dark place where there's no way to come out of it. And working with a therapist is basically processing it. It's not necessarily solving it, but it helps process a lot of emotions. Another thing is misconceptions. A lot of people think like, oh, I'm not mad, I don't need to go to a therapist. But again, like, to know that therapy is not a place where only mad people or people, I mean, there have been historical discrimination, so it's important to also be aware of that there could be misconceptions that could prevent refugees from getting access, even though they have access to therapy. Another thing is denial. There is a huge fear of, because, for example, if someone's alone by themselves and they have like a family back at home and they're worried about feeding their family, there is a worry that if I start thinking about these thoughts and I start processing my emotions, I will never be able to come out of it. So it's like a way of avoiding it. It's denying it, and it feels safer to deny it sometimes. But denying it is like hiding a wound. You're hurt, you have this wound, and if you hide it and just move on with your life, the wound will rot. It can be scary to go to a doctor and clean it up. It can be very painful to clean it up, but it heals. So again, that's also a myth that denying it kind of solves the problem or keeps you safe. Rather, it makes things worse. Like you said, this knot, if you see in this therapy, it just keeps getting worse. And yeah, and there are other concerns like insurance. What if my details are not confidential? What if people come to know? There's already worried about what if I get kicked out? What if I end up saying something that will put me in trouble? So these are certain barriers that we might experience. And yeah, the next slide I think is on how you can help. Either if you're a person from the community who's working within the community, or in any way that you're involved with them, how is it that you can help? The first thing I would say is psychoeducation. Like I said, there is a lack of awareness of what therapy is. And sometimes it just helps to say that therapy helps because you had community back at home. If you had a problem, maybe you went to your neighbor and cried for 2 hours and felt better. But here in America, probably you're alone and there is no community, and it just helps to speak with a therapist. Another thing is psychoeducation about cultural adjustment. A lot of people feel like if they are feeling lonely or bad or terrible, it's just them. So Adina will be talking about the cultural adjustment curve after this slide, but cultural adjustment can be a challenging thing, and psychoeducating them about that and how it helps to go to therapy. Another thing is that they trust those who have helped them or those who have the same experiences. So if you're a refugee yourself or an immigrant, or if you've been someone who's been helping them in their community, they trust you. And that's why when you tell them that this is how therapy is, they're more likely to trust you as compared to just reading a flyer or watching information somewhere else. You can also do this by showing care in your community. You can organize community events, and we're happy to come and do workshops, seminars, group therapy, support groups, or even culturally appropriate ways of care. It could just be like women getting together and cooking together. Anything that is therapeutic, singing together, music together, is something that you can do, and we're happy to help support and facilitate that. And the last thing, if you don't know what to do, or if it's too hard, then you can simply direct them to us and just be like, hey, there are these people you can talk to, and they'll tell you what therapy is. And sometimes even not using the word therapy, but just letting them know that there is someone who's there to listen to you and who wants to help you process because it's hard to be in this new space. So basically just directing them to us can also be helpful.
So I'm just going to share a little about this U curve of cultural adjustment. We had actually gotten this from, some of you might know Leslie Olson from Des Moines. She's in the U.S. Committee for Refugee Immigrants and the Refugee Wellness Program. We actually met her at the PM Plus that Will was talking about at that organization, which was such a great thing for me and John B to get to meet around the state, different people who are also passionate about helping refugees and immigrants. So she shared the slide. I went and spoke with her one time about how she explains to refugees and immigrants a little about the process, which is most importantly a normal process. So we might sit with a client and start and say, oh, it was the honeymoon phase right before you came. Maybe you got your visa, your ticket, you were so excited to come here, and you thought, I'm going to leave all my problems behind. Everything's going to be perfect in America. Not, of course, everyone comes with that, but there may be a lot of people who come with very high expectations that are absolutely not going to be met. Some of those might be that I'll be given a house when I come here, a car, I'll get a job, that everything will be taken care of. Then they kind of go into stage 2, which is culture shock, where everything is not what you expected. You're struggling to find a job, figuring out school for your child might be challenging. You don't even maybe know how to shop in the stores because you're not sure how to use like food stamp cards or something like that. You might be challenging just to even find housing. You also might be getting pressure from your family at home, like, come on, send us money. And, you thought it was going to be really easy to come and, make money here and stuff. And so there's maybe pressures from home and also just real confusion. You might be sad, angry, you might even want to go home. And so this is the time you can see we have a little arrow that this is a time that we would love to support you in that process, mostly to tell you that it's normal that you're going through this, and that we can just help you talk through it, and help you try to connect you with resources as well. And then eventually you get to stage 3 where you start to adjust, you start to get housing, you start to figure out the system, you learn English more, your kids get settled. And the idea is that it's a process and that you don't have to, everything doesn't go quickly. The last one, mastery, is, that you feel so confident that you might even be able to help other people. And you might check in with a client and say, where are you on this? And this isn't just a linear thing, like you go, you might go back and forth, into different stages or something like that. But to kind of ask someone when you first meet them, like, where are you on this cultural adjustment? And then that allows us to kind of help figure out, how to support them in that. And some of the benefits that we have of counseling is, in our program, is obviously we're culturally sensitive because we're specifically aiming only helping immigrants and refugees in our community. And we are doing it on Zoom as well as in person. So if it is somebody outside of Iowa City, they're welcome to do that. It is low cost or free. It's $2 to $5 a session if they are employed. There's no insurance needed, so we're not having anything that will get. I don't know if they're concerned about documentation and things like that. We have really competent supervisors that are working with us. And then we do have interpreters set up for Spanish, French, Arabic, Swahili, and Ukrainian. If there is another language, we're definitely open to helping you find somebody, or we could help try to find somebody. Like I did have someone just asking about Cambodian. And so, we're searching for that. And if you know other interpreters that you want to send our way, we are just having people do this for free right now, the interpreters, because we don't have funds quite yet to pay people. But feel free to send interpreters our way that who might want to volunteer, just even with one client a week. They don't have to make like a huge commitment. We're working on getting all of our social media in multiple languages, as well as our brochures, which has been a just learning process. And so we'll just kind of end. If anyone has any questions, this is our phone number and our direct email. And I'll just kind of stop sharing. Well, I could leave that for a second in case anybody needs to screenshot that or write it down. And I'll actually just write that in the chat too. So I'll just stop sharing if people have any questions, or we're also open to if you have suggestions, because I should have mentioned that Iowa Refugee Counseling Center started right before COVID, just for about a year and a half, and then COVID hit and tried to kind of make it through COVID, but didn't really make it. So they just paused for a few years during COVID, and then we're actually restarting it up again this fall. So when I say, because this alliance I know is about community supporting each other within the people on this call, that if you have ideas about how we can support people better or connect in with other communities, we're totally open to any suggestions that you all have too.
Well, thank you so much for that. And what a wonderful service. I love the fact of how accessible it is. So, and in terms of, look, you are at Iowa City Compassion, then you also said that you have hours at Open Heartland. Is that right? In terms of your physical location?
You want to talk about that, John V? Oh, I can. Okay. So right now we're partnering with Open Heartland, which many of you may know is in Iowa City, and Elizabeth and Deb Dunn are the people that are organizing over there. We're connecting with creating a women's group. Actually, we're starting this Thursday for 10 women at a time. And if it becomes successful, we'll start multiple groups to meet with them once a week and kind of discussing with them what kind of support they would like. It came out of a discussion about Elizabeth actually sharing concerns about young people, teens, struggling with their families, and how when they come to the United States, they start taking on, a lot of the American attributes, and the families are unhappy with where that's bringing them. And so kind of just the cultural push and pull that I'm sure all of you are familiar with. And so that was kind of our intention of going in, to sort of help on a much longer scale, not like in a quick fix, more like creating relationships with them and helping kind of on a longer, we're going to hopefully do it over the course of the year to help both sides. So the idea of mediating between the two is our overarching goal, but just even starting relationship with them is our first step. So.
And I think I can just, sorry, I was just going to add that our idea was to basically, sometimes therapy is not like a direct way for a lot of cultures to speak about their concerns. And the idea was to be able to give a space which is culturally appropriate. So it's easy to talk in a group and to help each other. I think that's more culturally acceptable in that society.
Great, thanks.
Thank you so much, guys, for this wonderful services. We have been looking for it since a long time ago because everything has been costed by money. And as an advocate at NISA organization, we have a lot suffering from trauma and need like therapies. I was wondering, do you have like scheduling time, or just we have to walk in, or and the address is in Iowa City Compassion, the same building or different building? Yes, thank
Yes,
you.
we are at the IC. Thank you so much for sharing that, Elman. Yes, we're at the IC Compassion Building, which is 1035 Wade Street in Iowa City. We don't have walk-in hours, but if they could contact us via phone or email, that would be great. And then we could contact them back with WhatsApp. I know a lot of people in the refugee immigrant community use WhatsApp, so we're trying to expand to communicate in ways that is most efficient and available to people. And then we could just figure out a time. We have a lot of availability to figure out a time to meet with them.
Thank you, thanks a lot. Yeah, that the phone number in your the phone number that you put it work with WhatsApp, so I can use WhatsApp or through email. I can email.
Janvi, could you answer that?
Yeah, you can WhatsApp us, or we have the same number on WhatsApp too.
Okay.
So you can feel free to WhatsApp us.
Thank you so much. Thanks a lot.
Whichever works better, because I know a lot of people don't use email. So whatever works best for people, I think we're open for that.
That's great. Other questions?
Yeah, I have a question. Well, firstly, I want to say I really loved your presentation, and it was really helpful for me to see the visuals, especially that timeline you were talking about of arriving to the United States for the first time and kind of what that process looks like. I wanted to ask, in your experience, do you ever use visual resources like that when you're working with in counseling, and do you find that those you're serving receive those types of visuals well?
I think it doesn't, we don't necessarily show visuals. That's how I would say. It's just about, it's seeing where the client is at. Sometimes it just helps to express, like for a client, if they're just like, why should I talk about it? How it's going to help? So I think the answer is to cater to that, not necessarily like show. That's how I go about it, is just to gauge where the client is at and be able to respond to the client in a way that is appropriate for them.
Thank you.
I also love the visual of the jumbled up wires and then things kind of organized, because I think that also is a really great picture of how therapy can kind of help you just sort through and, you know, organize your thoughts on when you're struggling with something. So I think that would be really useful in recruitment of people, you know, just help them understand how this helps, you know, how talking helps. So they're really good. Did you guys come up with those? You must be.
The U-curve I got from Leslie Olson at the U.S. Committee for Refugee Immigrants.
Oh, okay.
I'm not sure where Janvi got the tangled up one.
Okay. Well, whoever did it, it was very nice. I thought maybe you were super creative people and we'd hit you up for something else. The question.
Yeah, thank you. Yeah, thank you, Iman, for remembering to ask about WhatsApp. And even if Genevieve is not here, it's great to hear that the option is there, because some time back, my millennial son referred to WhatsApp as the immigrant app, and it's really popular. So it's really relevant with that population, and an option to versus email, where some of them are really technology, and especially because the population you're dealing with is very poor and very marginalized. So it's good to hear that WhatsApp is an option.
I'm glad to hear you, River, reverberating that because that is actually something we're just recently doing based on the fact that people were having a hard time communicating. So I'm glad to hear you saying, kind of affirming that.
I've also found WhatsApp is really, you can use Google Translate pretty easily too. So I'm able to communicate through WhatsApp, even to people who don't speak English pretty easily. So that's been a nice perk of that as well.
Yeah, the other thing I'm appreciating is the asking for interpreters, because last year I looked at your website and I felt really sad because through COVID, there was so much need for mental health services. And looking at our population, we work with people who are suffering from domestic violence. Already that is happening. They're from a marginalized community. And then I looked at your website and you had stated you do not, and the clients I was going to refer, they use Swahili, French, and Arabic. And then I saw on your website that you had written, you do not have those languages. I'm like, so I'm glad to hear from this meeting that you're having interpreters and you're calling for them. So yeah, I'm really glad that we are at this point.
Yeah, I wasn't with the organization in the past. I know they did use interpreters in the past, but I didn't know that they had that on the website about that. They stated that they didn't have
During
interpreters.
COVID, during COVID.
Oh,
Yeah,
okay, yeah,
during
must
COVID.
have.
Yeah,
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 I understand. Yeah, okay, thank you.
yeah.
Great. So other questions? Thanks so much for presenting, and I'm so sorry that we couldn't accommodate her request to go first, since Will Story asked me first. So thanks to her for her flexibility on that. So I think great presentations that actually kind of go together. It sounds like Iowa City Compassion will probably be one of the partners for Will Story's M Plus program. So good things going forward. And I think we're through the worst of it on COVID and all the barriers that presented for both programs. So I think we have about 5 minutes if anyone has any announcements or information to share.
I have a quick announcement. Just a reminder to everybody that we do have certified application counselor assistance available through Johnson County Public Health to assist with signing up for insurance through the marketplace. Open enrollment will start on November 1st. And I left brochures at IC Compassion. We also have some here. So it's the same. If you've seen our brochures in the past years, we do this every year. There's a telephone number and an email that you can reach out to our contracted person. She will have some in-person availability here at Johnson County Public Health, but most of her work is done either via telephone or on Zoom because she doesn't live in the area. So she does come here a few times.
Could you maybe put her contact information in the chat?
Sure.
Be great. Thank you, Jennifer.
Yeah, but I did leave, Teresa has brochures, and if anybody else needs any, you can let me know. I'll put my email in here and I can shoot you the document and you can print it off.
Great. That's quite a process to navigate. So thanks for having a person to assist with that.
You realize that in the, I blind copy people when I'm sending emails because I don't want to expose people's emails to everyone. But if you have any information, documents that you want to be posted, you can reply to that email, which would come to me directly, and I'll post it to the mailing list. If you have anyone that would like to join the mailing list, please send the email to me and I'll add it to the mailing list. Thank you.
Other announcements or thoughts? Our next meeting will be November 28th. I thought I had someone from the law school, but they actually have a conflict, and that we'll be holding that in January. So if anyone has a topic that they would like to share or a recommendation, we will be looking for a topic for November, since our legal issues topic will be moved back a little bit. So we'd love to hear your suggestions. Great. All right. Well, if no one else has anything else to add, I think we can adjourn 3 minutes early, and don't forget to vote. So that's an election coming up between now and our next meeting. So I think a lot of really important issues that have a big impact on our folks that we're advocating for. So, and with that, I hope you all have a great day, and we'll see you in November.